I look at all the faces, furious, terrified Peggy, sepulchral little Marcia, Vicky with her social ease and uninterrupted memory, and Sybil.
Dissociative identity disorder, or more commonly known as multiple personality disorder. It's a disorder where people have two or more distinct personalities, and these personalities can interchange and take control over the main conscious personality. In other words, people who have this disorder will enter into a fugue or blackout type state, and during that time, the other personality takes over and does whatever they want with their body, pretty much. People mostly develop this disorder if they have some sort of physical, mental, or sexual trauma, especially during their childhood while they're still developing. So, how do you know if you have dissociative identity disorder? Well, some symptoms are like depression, mood swings, suicidal tendencies, sleep disorders such as insomnia or sleepwalking, anxiety or panic attacks, reactions to stimuli like seeing something and it triggers a flashback, alcohol or drug abuse, compulsions and rituals, psychotic-like symptoms such as auditory or visual hallucinations, time loss, headaches, trances, out-of-body experiences, and some may even try to self-persecute or self-sabotage themselves. So there are really three main theorists when it comes to dissociative identity disorder, and that would be Pierre Janet, Morton Prince, and Boris Sidz. Now the main one was Pierre Janet. Now his big ideas was about hypnosis and the unconscious mind. Now he argued that when you're unconscious, it's not really just that person being unconscious, it's just a different conscious state. And if you're under hypnosis, that conscious state is kind of like a different personality. And basically his idea was just that unconscious type of personality was always there. It's just was unconscious, just a different part of you. And that's basically what dissociative theory is based off of, was his ideas about hypnosis and the unconscious mind. The second theorist was Morton Prince, and he tried to just build off of Pierre Janet's work, and his whole thing was about the different levels of processes that people have. Basically, his theory was about how people could perceive things and record information, but that's different when you're conscious versus when your subconscious perceives and remembers things. In other words, let's say you go under hypnosis, and even though you remember everything, it's almost like you're reliving that thing. Whereas when you're conscious, you just remember it, but you don't ever really perceive it like you're reliving that memory all over again. So his was pretty promising about just the different perceptions that people could have, even when they're subconscious and not fully aware of themselves. The third one was Boris Sidz. He dealt with a more psychological approach to the power of suggestion. And he actually looked more into biological point of views as well, and studying how neurons worked in the brain and how we perceive things and such, and that was basically his work on dissociative identity. So what about the treatment for dissociative identity disorder? Well, there's not really a cure yet, but there are things that can help people for long-term problems. Things such as psychotherapy, hypnotherapy, adjunction therapy, which adjunctive therapy is just like art or movement therapy. Also, if you do have dissociative identity disorder and you have other disorders as well as that, like depression or anxiety, you can take medications for that as well, such as antidepressants. And that can help with those conditions, but it won't help you with your dissociative identity disorder itself. But there are some theories about hypnotherapy. A lot of people believe that if you go under hypnosis as a person with dissociative identity disorder and you are introduced to your other personalities, then you could slowly, through months or years of this type of integration process, slowly connect these personalities back into one whole person. But there's not really a whole lot of cases on that because this disease or disorder is really rare, and so not a whole lot of evidence about this, but it is a promising type of treatment. And there is everything that you need to know about dissociative identity disorder, and I hope this helps you. Thank you.